We've just performed our osteopathic structural exam on our patient, and within that context we found that the cervical region was actually the most problematic. We also found that our patient's cervical region was actually more rotated to the right. That was her position of ease. She has restriction in rotating to the left. We'll now be addressing that somatic dysfunction using articulatory technique. The first thing that I would like to do is I want to flex my patient's head up slightly just to localize my forces here at the axis where the majority of the cervical rotation takes place. At this point, I'm going to be cradling my right hand underneath of my patient's occiput. So my left hand is actually free now to gently grasp or cradle her chin, and I'm now going to rotate her into that restrictive barrier to the left. Once I've met that restrictive barrier, I can now gently come off towards neutral, and I'm going to repetitively engage that restrictive barrier in a smooth, rhythmic fashion, each time attempting to go through that restrictive barrier a little bit more. I can repeat this 10 to 50 times, but each time I just want to feel like I'm just going through that restrictive barrier a tiny bit more. This is a direct and passive technique. And right here at this point, I'm starting to feel that there is very little restrictive barrier left. Feels like the somatic dysfunction is resolving. And so once I feel that, I can gently cradle my patient's head once again, return her head back to neutral, and bring her back down. From here, I can reassess in the same way in which I initially found that somatic dysfunction. I'm just going to be assessing that rotation. So I'm going to go to the left, which was originally the area of restriction. And now to the right. And the rotation here now in the cervical region does appear to be symmetrical, so I feel that articulatory technique was indeed successful and actually helped to address the somatic dysfunction.